number of deaths that we have suffered and the number of confirmed cases has roughly doubled.
We need to do more. That is the message from Governor Jay Inslee tonight as he extends the stay-at-home order for another month. And that means that many businesses are going to have to remain closed. Good evening. I'm Joyce Taylor.
I'm Greg Copeland. Tonight, Britt Moore spoke with a restaurant worker who's trying to figure out what the industry will look like once the order is finally lifted.
Governor Jay Inslee says he's optimistic, but not ready to remove restrictions. He's extending his stay home, stay healthy order to May 4th.
And I know that we need to think about all of the ramifications of this order. They are a heavy weight on all of us, including myself.
It's the latest move to flatten the curve here in Washington, a quote, morally necessary action that could have long-term economic implications.
And we think of the owners of small restaurants tonight, and we're looking forward to them reopening. It's one of the reasons we want to beat this virus as soon as we can.
The restaurant industry taking a massive hit. According to the latest state report, there were more than 20,000 unemployment claims filed last week and more than 40,000 the week before.
The short-term problems are how are we going to pay our rent just with the unemployment insurance. The rents are high here in Seattle. Workers like myself rely on having customers every day to be able to manage our bills.
Simone Barron has worked in the service industry for more than 30 years. She says each day that passes is only making the situation more complicated.
The further that this goes, where people are not able to do business and not able to go back to work, the less money we're going to have, and the more restaurants will probably close permanently.
Barron says she thinks restaurants will have some adjustments to make if and when things return to normal.
And it's scary right now to see that all the insecurity around whether or not restaurants are going to be reopening and whether or not we're going to have jobs to go back to.
Britt Moore, King 5 News.
Today, the governor also held a virtual town hall where people could ask him questions directly. One person asked what he would say to people who are still getting together with their friends.
Because if you have friends or relatives that are practicing social distancing when they're sort of in public, maybe even in the workforce, but then they have friends over and sit around the table having dinner real close to them, or go, if you're a grandparent, and go wrestle with their grandkids, that is every bit as fatal, and you can get and spread the disease every bit as much.
Governor Inslee's list of essential businesses allowed to stay open does not include gun dealers. Still, some, including Wade's Eastside Guns in Bellevue, are not closing. The store posted a statement on its website saying, as far as the state and all of us are concerned, your right to the protection of yourself, your family, and others is an essential need and a constitutional right. The Trump administration has said that gun shops should remain open.
Now, the governor says you should still stay in touch with your friends and your family, but do it virtually. Chris Vanderveen shows us why right now this is our only defense.
Bloop. See that? That's you. And you have the measles. And those dots around you, they have zero protection against the virus. Science tells us eventually you will infect upwards of 15 other dots, thanks to something known as an R naught. Yep, R naught, a fancy term that tells you how contagious a disease is. The R naught of measles, around 15. The R naught of smallpox, 6. Both are very contagious, but measles remains rare, and no one gets smallpox anymore. Credit the rise of vaccinations, an effective shield against contagion. Maybe a few dots received one, maybe that one didn't. But see what it does to the spread? Now let's take the new coronavirus. Its R naught of 2 or 3 suggests it's not as harmful. But as of now, no one has protection. There is no vaccine. So you and your dot could infect 2 or 3. And those 2 or 3 could infect 4 or 5. And so on and so on. In the U.S., the number of cases is doubling every 3 days. A true case of exponential growth. But let's say you decide to social distance and only infect 1, not 2 or 3. Your neighbor doesn't go to work. Your coworker doesn't hit the park. A stranger stays home. Infections can still happen, but the odds of any one dot infecting 2 or 3 others decreases thanks to distance. The contagion slows. Exponential growth turns into linear growth, if not this. Until there is an effective treatment or a vaccine, physical distancing represents the best odds, say infectious disease experts, one by one, connecting the dots by doing nothing more than disconnecting them.
Nationwide, 213,000 cases of COVID-19 have been confirmed. 4,500 people have died. We don't know how many have recovered from the virus yet. The CDC has not made that information available. In Washington state, there are now 6,500 cases, up more than 500 from yesterday. Of those, 262 people have died. That's about 4%. It's important to note nearly 75,000 people have tested negative.
We're learning more tonight about how deadly coronavirus can be for the most critically ill patients. UW Medicine just released a study which outlines some troubling outcomes for people in intensive care. King 5's Ted Land has more.
UW Medicine studied a group of critically ill coronavirus patients who had to go into intensive care in local hospitals. They say of the group of 24 people they studied, half of them died.
It's important to keep in mind these patients were the sickest of the sick, and the majority of them had underlying conditions like diabetes, high blood pressure, and kidney disease.
There was a wide age range where the youngest person was in their 20s.
Dr. Pavan Bhatraju is lead author of the study. He says another important finding was that patients who had to go onto a ventilator to help them breathe spent an average of 10 days on the machine, a lot longer than ICU patients with other respiratory problems.
The earliest the patient was able to come off the ventilator was 8 days. And I think this is a small case series, but it's some of the findings are consistent with the reports that were published in China, as well as the reports we're seeing from Italy, where the mortality rate is quite high.
He says he hopes the findings will help hospitals better manage limited resources, knowing patients may spend weeks fighting the virus.
I think there's a lot of fundamental questions we still don't know about this infection. Why are some people more susceptible to developing critical illness than others?
The researchers say they hope their findings will make doctors think twice about the symptoms that patients show when they first report illness. They say the most common early symptoms were cough and shortness of breath, but not necessarily fever. Those mild symptoms, though, eventually got much worse. In Seattle, Ted Land, King 5 News.
We don't want any American to worry about the cost of getting a test or the cost of getting treatment.
Vice President Mike Pence announcing today the White House is considering direct payments to hospitals to cover the cost of treating the coronavirus for uninsured Americans. This as many hospitals are considering furloughing workers, and among them, Virginia Mason. Tonight, we have learned that financial losses connected to the coronavirus. It means that Virginia Mason Medical Center will begin furloughing some of its workers. King 5 obtained an internal memo outlining what company executives said was a 30% drop in revenue. We asked Virginia Mason for a comment, and they sent us this statement saying, some employment furloughs will occur, but no layoffs are planned. We are also temporarily reducing compensation for our executives and some physicians while taking action to control our non-local costs. The hospital blames a drop in revenue on the many non-essential surgeries that have been canceled, also the clinical visits that have been reduced significantly. Virginia Mason is one of the largest healthcare providers in the state of Washington.
Life Care Center in Kirkland is now facing fines and could lose its Medicare contract. And this comes after a federal investigation that claims patients and staff were put in immediate jeopardy. King 5 Sebastian Robertson has more on what happens next.
That's Russ Rapp in the distance. He's loading his late mother's personal belongings into his pickup truck. Loretta Rapp was a patient at Life Care Center of Kirkland, and according to her family, she contracted the coronavirus and died.
It's tough that she spent the last days in isolation at Providence. Couldn't even see her or anything, so that was tough.
A long-term care facility caught in the middle of a pandemic that now the federal government is saying didn't do enough to stop the spread of the virus. The Centers for Medicare and Medicaid Services and the state's Department of Social and Health Services releasing its findings of a survey conducted on March 16th, claiming in a report that there was, quote, no evidence the facility recognized all possible systemic risks and concerns, adding the facility failed to quickly identify and manage sick residents, saying they continued to admit new patients as recently as February, quote, placing these residents at risk for infection and death. Rapp's mother was one of those patients.
The last thing I told her was, chins up. I'll bring your laundry back as soon as possible, and that's the last I had to say to her, I didn't know, you know. What are you going to do?
The Life Care Center is still operating. They have until September to make the necessary changes, or they could be fined as much as $600,000 and lose both Medicare and Medicaid funding.
Since she passed, I've kind of closed the door on all this stuff here.
The end of Rap's story. But for the Life Care Center, their story continues to evolve. We did hear from the Life Centers of Kirkland this afternoon. They say that they're working closely with the Centers for Medicare and Medicaid, and that they've even made some of the requested changes, but say they do plan to appeal other findings. They wouldn't go into specifics and say they won't be publicly. In Seattle, Sebastian Robertson, King 5 News.
Time now for the top 5 on King 5. A fire ripped through this home in Kent near Lake Meridian Park. Sky King flew over that area earlier tonight. Puget Sound Fire said it was worried that fire would jump to nearby homes. No word yet on whether anybody was hurt. The Washington National Guard is out helping distribute food at some local food banks. Right now, Guardsmen are supporting operations at 3 banks in King, Pierce, and Chelan counties. More locations will receive help in the coming days. King County plans to move hundreds of homeless people from shelters to hotels to try to slow the coronavirus spread. 400 people staying in shelters will move to one of these 3 hotels: Hotel 116 near downtown Bellevue, the Quality Inn at SeaTac Airport, and a Red Line Hotel in Renton. Those who rely on food assistance will see an increase in how much they receive for March and April. A family of 2 who regularly receives $200 a month will receive an extra $155. Those who already receive the maximum benefit will not see an increase. Tacoma Public Utilities has pushed back a planned rate increase. The utility voted to move that 2% rate increase from April to July 1st.
Making some noise to make sure one special lady isn't forgotten.
Also, if you have extra masks, gloves, or other personal protection equipment, there are now several locations where you can donate it. And some Seattle artists are sending a message of hope.